Arizona has quite a number of propositions on the ballot this year. An important one is Proposition 106, often called the Healthcare Freedom Act. This prevents government from forcing you to buy a government-approved health care plan, though the bill says you can still buy it if you want to. Do you plan to support this legislation? If so, please tell us why you're supporting it. If not, why not?
Well, I'm a private citizen, and yes, I will be supporting it because I'm opposed to the federal government being involved in my healthcare decisions or your healthcare decisions. When I think about healthcare, these are very difficult and they're very personal and they can be very challenging. So I know the right answer for me may not be the right answer for you, and this is a complicated discussion point, and yet I firmly believe in the free market. I believe that competition is healthy. I believe it allows companies to compete with each other and for us as consumers to benefit from that. So yes, I'll support it as a private citizen, but I'll also work to enable that same position in Washington so that we as individuals have the ability to pursue and to choose the kinds of insurance that we want or the health care that we want. Going back to my decision to move into this and to run for this Senate office, this was a tipping point for me. I own my own company. I don't want the federal government requiring me or telling me that I have to buy insurance. It's not Thank you.
Dr. Gosar.
I full-heartedly support Proposition 106. And I'm proud to say that I was one of the supporters on Prop 101 when it came about 2008. Folks, it's about time we had a doctor in the house. Literally. What a great time to listen to you, to hear what's wrong with you, to develop a treatment plan and deliver that treatment plan. But it's about you accepting that treatment plan. How dare the federal government tell me one size fits all?
Yeah.
And I'm one of those people as a private citizen that has pushed national agenda items by taking away anti-competitive practices that insurance companies share about you, that they now must try to compete fairly against each other in a free marketplace. And that number two is that we hold public health accountable. These are your tax dollars, folks, and they should be best used here at your discretion. And last but not least, we need some tort reform, folks. One of the basic things that I've seen as sitting chairside 25 years is being able to present that plan to you, and you accept or find another treatment that fits you best. One size doesn't fit all. Please tell me one program that the federal government oversees or is part of that actually works.
Well, my answer is going to make me real popular with this crowd. No, I don't support the proposition. And this is about the health care reform bill. And look, I read the bill, and I talked with lots of people. I heard from the Tea Party. I know you're opposed to it. But I'm proud of my vote, and I will stand on my vote. And look, folks, I always say, we're not going to agree 100%. I mean, heavens, I don't agree 100% with my husband. But you have a right to know where I stand and why. So let me tell you. The other day I saw a billboard that said health insurance for $49.99 a month. Prior to health care reform, we didn't know what that means. But now we do. We know that that means that children with pre-existing conditions like asthma can get on their parents' health insurance. We know that folks who have paid their premium for years, who get canceled when they get sick. That will not happen anymore, nor can they get kicked off their insurance if they have a treatment that's expensive like cancer and there's a limit. There are no more kickoffs of the insurance policies, and there are no more caps. And thirdly, we know, and I've talked to a lot of seniors who get hit with the donut hole, and it's really critical that we address that for our seniors. And so they've gotten their first wave of help with that, and that will continue, and over time it will close. Now let me tell you, there were some good Republican ideas in the health care bill, including portability. And that was something that John McCain supported. It's in the bill. But look, folks, you know, over time, it's going to save $140 million. It is not.
And on that note, we need to call time on that question. You, Representative Kirkpatrick, you will get the first question or first answer for the next question.
One sentence to wrap up. Look, folks, I hear you, and I want to hear you. And the bill's not perfect. I want to ask you to continue to work with me to address these problems.